Well, the impact of RSV in Spain for children, it has been really high. In our country, we have estimates of 50,000 hospitalizations every year. The Spanish NICTAC and the Public Health Commission made the decision in a fast way to be able to protect the children we consider. Specifically, burden of disease, the efficacy data, and of course, safety data. And with all these combinations, we all agree that the protection needed to be for our babies. We decide to implement the strategy, the monoclonal antibody, in primary care settings for children born out of season before October, between April and September, and in maternity wards in hospitals before the discharge. One of the things that we consider that it was very important for the success of the strategy was treating the monoclonal antibody as a vaccine. People understood that as a vaccine, even the media and all parents treat it as a vaccine, and then make the acceptability of the strategy much higher. The awareness campaigns are a responsibility of the different regions in Spain, and we made them basically for parents. They were really aware of the bronchiolitis, but not so much about RSV. So our materials, brochures, webpage, testimonies from parents were based on bronchiolitis, and of course about RSV as the etiology of bronchiolitis. One of the big reasons to this high uptake was that all infants were it was free at the point of immunization, and of course there was a lot of strategies to get them in the healthcare centers to make an active immunization in the sense of taking them, so phoning them, sending them text message. One of the success points about the campaign was the involvement of the healthcare professionals. We got involvement with, of course, training, online and person training for all professionals. But besides that, we involved them in the process of making the protocols. And that makes a really good point because all of them were involved in that process and consider that it was their protocol and not an outside protocol. I think that about the take-home messages all of this, is that we have a big problem about RSV infection. We had a big opportunity and a big solution about monoclonal antibodies, and the good point is that we are producing data for implementation and for effectiveness data that we are going to serve very short time. We have begun about that to all the other countries interested in this strategy that I think that is a great strategy.